Some of you might be asking the question of your doctor whether or not you should receive intravenous saline. And just to be clear, what is intravenous saline? It is an infusion of fluid into your veins via a cannula, which is a plastic tubing that is typically inserted in your antecubital fossa opposite your elbow. And this is the treatment that has been suggested by some to be very helpful in improving your symptoms. Now, I am personally against intravenous saline, and I'll say this for the following reasons. Number one, intravenous saline is something that only works momentarily. It might give you a transient sense of improvement because you're getting a big bolus of fluid in you. But my view is that if your gut is working fine and you can swallow and you can digest and absorb, then you can have the same effect with drinking fluids. And I think we must really emphasize that intravenous saline is nothing more than expanding your fluid volume. There's nothing special about saline. It just gets pushed into your bloodstream, expands your volume, makes your blood pressure improve, and makes you feel better for a short while. What will happen undoubtedly is you'll start to pee more. As your volume expands, you pee more. It's the same physiology if you drank some water. In fact, if you drank the same amount of water as normal saline, it might take a bit longer to get absorbed into your system, but most of it would. And when it gets absorbed, you'll start to pee more again and you'll start to feel better. So that is my view about intravenous saline. And the reason we shouldn't be giving it is because A, you can do the same with water, but B, more sinisterly, you will be subjecting yourself to repeated cannulations. So you might have to go into hospital every 2 or 3 days or every week or two. And every time you go into hospital, you'll be asking for a cannula or a needle to be put in one arm crease and then the other again. And after a while, it can become dangerous as your veins are no longer able to accept more cannulas as they fibrose and they close off. And then it gets harder and harder to gain access to give you that intravenous saline. Thirdly, I think it's the wrong philosophy because it means that you put the power of control and well-being in the hands of somebody else. Now, if you can drink and if you can swallow and if you absorb, why not drink more water? And saline is just salty water. Add salt in your fluid and get it naturally, because if your stomach is working well, it absorbs in exactly the same way. So those are my views about intravenous saline, and I would say I disagree strongly with having this on a regular basis.